Good day everyone. Today we will be discussing about the drug named gabapentin. Gabapentin comes under the pharmacological category of anticonvulsants. Gabapentin is an anticonvulsant agent structurally related to the inhibitory CNS neurotransmitter called gamma-aminobutyric acid or GABA. Gabapentin anacarbal is a prodrug of gabapentin that is rapidly converted to gabapentin following oral administration. The therapeutic effects of gabapentin anacarbal are attributed to gabapentin. Although gabapentin was developed as a structural analog of GABA that would penetrate the blood-brain barrier and mimic the action of GABA at inhibitory neuronal synapses, the drug has no direct GABA mimetic action and its precise mechanism of action has not been elucidated. Gabapentin is indicated for post-herpetic neuralgia and serves as adjunctive therapy for managing partial seizures in adults and pediatric patients aged 3 or older. Gabapentin anacarbal is indicated for post-herpetic neuralgia and moderate to severe restless leg syndrome or RLS. The FDA also approved gabapentin for managing post-herpetic neuralgia in adults. Recently, gabapentin underwent systemic evaluation in the management of diabetic neuropathy. According to the guidelines from the American Epilepsy Society, clinicians might consider gabapentin as a potential option for patients aged 60 and older with new-onset focal epilepsy, as it could be similarly effective and better tolerated compared to carbamazepine. The American Academy of Sleep Medicine suggests the use of gabapentin for the management of moderate to severe RLS. Furthermore, the American Academy of Neurology substantiates the efficacy of gabapentin anacarbal in mitigating symptoms of moderate to severe primary RLS. This slow-release gabapentin prodrug reduces International Restless Leg Syndrome or IRLS study group rating scale scores and significantly improves subjective sleep quality. Gabapentin also has following off-label use. Avoid alcohol if you are taking gabapentin. Gabapentin possesses CNS depressant activity that may be potentiated by co-administration with alcohol. Gabapentin can be taken with or without food. The American Association for the Study of Liver Disease recognizes the potential role of gabapentin as a primary non-opioid therapeutic choice, particularly for managing neuropathic pain in patients with cirrhosis. For patients with renal impairment, gabapentin, which is primarily excreted renally and lacks active metabolites, requires dosage adjustment. Therefore, it is crucial to modify both the dose, amount and frequency accordingly. The FDA has not approved gabapentin for treating partial seizures in pediatric patients aged 3 or younger. Gabapentin can be considered for pain relief in terminally ill children. The following are the severe and common adverse drug reactions observed during the administration of gabapentin. In a study analyzing adverse drug reactions associated with gabapentin through the FDA, it was found that compared to duloxetine, gabapentin showed a higher likelihood of drug withdrawal, auditory hallucinations, delusions, euphoric mood, ataxia, aggression, and substance use disorder. Concurrent use of gabapentin and pregabalin is contraindicated. Reports of respiratory depression and sedation, occasionally fatal, have emerged with the co-administration of gabapentin and opioids like morphine, hydrocodone, oxycodone, and buprenorphine. Concurrent use of an antacid containing magnesium and aluminum hydroxides reduces gabapentin bioavailability. To mitigate this interaction, gabapentin is recommended at least 2 hours after administering the antacid. Gabapentin's addition to other anti-epileptic drugs might lead to false positive readings of urinary protein. Clinicians should check baseline creatinine levels before and during the treatment. Patients should be informed and screened for depression, behavioral changes, and suicidality. Before prescribing gabapentin or other drugs, clinicians should check for iron deficiency, as it is associated with RLS. Thank you. Kindly comment for further queries and doubts.